Next, we have Brian Kaney from Monster.
Thanks. So this slide I actually filled out. The last presentation I forgot to fill this one out. So yeah, I'm Brian Kaney. I think I know a lot of you, work with a lot of you as well from Vermonster. As far as FHIR implementation guides, I do some work with CPG, CRMI, and the SQL and FHIR. And some of my background is I've spent a lot of time doing CDS, clinical decision support, and a lot of that was originally in oncology. So I kind of frame this up like challenge and then solution as we go through this. I think a lot of us know that there's a lot of knowledge growing. This is not a AI talk. Oh, no one's left. Great. Actually, it is an AI talk. It's an expert system, which technically is never mind. We're finding that there's more and more emphasis on best practice guidelines in large organizations and smaller organizations to try to not only have the best outcomes for patients, but also have less variation and be able to control the costs. It's kind of part of this bigger clinical quality lifecycle picture where it's this feedback system where research happens, guidelines are created by medical societies or other types of institutions. It's delivered at the point of care, and as a side effect of delivering care, data is generated that kind of feeds back into the whole system. And so this cycle is modeled in FHIR and through a couple of implementation guides that we're going to be covering today. So FHIR implementation guides build on top of the core FHIR specifications. Some of them on this, I like how this categorizes some of them. There's like model IGs, so this is like the patient summary or US core, QI core. There's specification IGs, like the structured data capture, CPG on FHIR, evidence-based medicine, and then we have content IGs in the top right there, which is what we're going to be doing in the rest of this talk, which is effectively building on top of all of that to create the actual content. And in the case that we're going through today is in oncology. It's a cancer use case of providing guidance. And so we're going to talk a little bit about the US core and an implementation guide called mCODE, which was built on top of US core, specifically for oncology data exchange. Talk a lot about the CPG, Clinical Practice Guideline IG, a little bit about CRMI, which is mentioned towards the end, and then we're going to work on building this cancer guideline. Just a quick, you'll see some L1, L2, L3 references. L1 is these are representation levels of the information, where L1 is basically like PDF is the plain text prose, and then there's like different levels that increase in fidelity for computable rules at the very end here. And so the CPG IG goes through a methodology that has these 5 steps, basically. There's a select, represent, validate, validate, and then finally distribute. And we're, speaking of AI, we are finding during some of the translation step, when we're actually building these artifacts that represent the rules or the things that we're supposed to order, that we are having some luck using some AI as kind of an assistive tool. So the guidance that we're going to go over is neoadjuvant chemotherapy. So this is like therapy, like chemotherapy, medicine, basically, that you might get before your primary treatment for cancer. That's what neoadjuvant means. And TNBC is the triple negative breast cancer. So the tumor markers come back and they can be positive or negative many times, and this is the case where they're all negative. And the guidance, by the way, this is pretend content. I'm trying to make it look realistic, but I am not trained in medicine, so that's, I guess, important asterisks. So the guidance that we're modeling is if the tumor size is over a certain amount and they're triple negative, we recommend neoadjuvant therapy. If they're not triple negative or the tumor size is smaller, then we would not recommend it. So that's kind of the thing that we're modeling here. And so normally when we would do this, we would go through this process where we have a selection step. And so the output of this is some kind of L1 narrative content. Uh-oh.
This happened in the last session too. I think they unplugged and plugged back in.
Okay. Then it would be literal hand waviness. Is it, maybe I'll just plug it in directly to the HDMI, see what happens. Is it,
Just try
like I'm unplugging it? Oh, it looked like it flickered.
Yeah, let's give it a second here. Maybe take a look at mine.
Okay. Hopefully this works. So we've used this process before. It's like a Miro, or you could pick your tool, but we have like this selection canvas where we might go through and just have a high level, like, is this an area that we should be focusing on? We will pick the persona, and these are, this is all based on the CPG IG and some recommended or preferred value sets for some of these things. There's some process and settings that we go through following the CPG common processes, like if this is guideline-based care. In our case, we're at a medical oncology clinic, so that's our setting. And the activity here is order a medication. That's ultimately what we're doing here. And we might have some ways that we support this, because in CPG you can encode all of this information, like if there's a lot of evidence, is it a strong or weak recommendation, and if it's for or against. And so laying it out at this form allows like multiple people on the team to get their information incorporated into this part. The next thing is we represent these concepts, or next phase kind of in it is the representation phase. And so for this phase, we might have start making a data dictionary. Maybe that's in Excel or something like that. We have criteria, so this is maybe given when then statements that define like patient case, given a patient with XYZ, then this should happen. And then processes are kind of these flow diagrams where we connect these together. And a quick example of what that might look like for this is down here. So in this case, it's pretty simple. We're basically saying if you have a primary cancer condition, your HER2 ER/PR statuses are all negative, and you have a tumor size of a certain size, then you would order this. And so this is a very simplified use case. I know some of you have worked on some guidelines where this gets like to the point where Miro crashes. It's so big. So sometimes this is definitely a simplification for this talk. So the translation step, this is a fairly quick talk, so I'm not going to be able to go into a lot of details, but I'll kind of show you the outcome. I mean, mainly the big thing here is that in this example, I'm showing how we're using the mCODE directly. mCODE is a really nice project. It has an awesome landing page with this cool navigational thing where you can click around into the different parts of it. It's quite impressive. But for our use case, we're going to use they have a profile for primary cancer condition, tumor size, and tumor marker tests. And if we take a look at what that might look like, so basically, if you're familiar with FHIR shorthand, I can show quickly here and then flip to the generated output, which probably is a little easier to read. But in this case, I only need to create these 3 profiles for these 3 statuses because I'm building on top of the mCODE tumor marker test as a parent. And in my logic, I'm using directly, without touching it, the mCODE profile for the tumor marker size in the primary cancer condition. And so, yeah, I'll just flip to this, and we can kind of walk through it here. So we can see that these are the three that I'm actually creating in this IG, and you can follow it and see that it's based on the tumor marker test, which is one of the profiles that we get from mCODE. And so now we've identified our profiles. We have some terminology to do, and this is actually where I did use a little bit of AI. AI helped me create this value set of breast cancer ICD-10 codes. And so this is this is not a rules-based value set. It's a pretty straightforward one. And part of the process is this, because we need to know if the patient has breast cancer. That's one of the criteria for this recommendation. And so we don't care which kind of breast cancer. It could be any of them. And if you had a proper terminology server, you could probably do some hierarchical magic here, but I just listed them all out for this example. And there are, just quickly, some profiles on what it means for a value set to be shareable, computable, publishable in the CRMI IG. Now we have our activities, and in our case, we modeled out the way it works is like these regimens have typically a medication order that you take first, and then you follow it up with perhaps other medication orders that might happen in parallel or in series. And so we modeled all of the individual medication activities as medication requests, and this is used as an activity definition profile from CPG. So we have and the chemo is AC followed by T, which is used in this case. And so there's 3 drugs. They're all 14-day cycles, and we use Rx norm codes to identify what drug they are. And then we have combined those into an order template, which is a FHIR plan definition. And this order set allows us to give the AC course first, and we use related actions to structure before and after. So this is the AC phase, and then this is the T phase. And you can see the AC phase has these 2 chemotherapeutics, and the T phase has the paclitaxel one. And then we kind of put this all together into a plan definition, which represents the guideline itself. And the way we do that is actually, yeah, I'm going to actually show it here. Sorry, might be a little easier. So the way we do that is we have this plan definition that represents the recommendation, and it has a reference to a library where I have some logic I've written. And the expression is identified in CQL by the name has TNBC and at least T1C. So they have these 2 things, and I'm specifying here these are all the data requirements to run that. So this is what I need to actually execute that CQL, and I'm identifying them by using profiles. And so these 3 are the ones I made in this guideline, and these are the ones directly from mCODE. And so that's kind of how that's all put together. I think just as I'm running out of time, I'm just going to skip ahead to the demo and show, well, a couple of ways to visualize this. So we've been working on this this preview tool. And so what this does is it will go through the guideline and give us a nice visual. And as we click through on the items, we can actually see. So in this case, at the very top of the tree, you can imagine maybe this is under a breast cancer pathway, like a big pathway, and we have different strategies. So the one we're doing here is neoadjuvant, but there could be the primary therapy and then the regular adjuvant strategy afterwards. And this is now a strategy for the TNBC use case. I can actually look at my guideline logic here in this tool, and then I can see the inputs here, and ultimately I can actually even see my chemotherapy order down here kind of modeled out in this tool as well. And kind of the last thing I want to show, because I am getting pretty short on time, is we can also execute this. And so we've written some tooling that uses gherkin cucumber style tests, so given when thens, and this actually executes against a locally running CPG server and uses these test cases. And I can actually show you the CQL logic, and so you can see these are pretty straightforward, and these are fairly naive implementations. In the real world, there's a lot more to it, looking at time periods and things like that. But you've probably, a lot of you have seen this before. I can execute the CQL right on the tool, and I can see I have a patient test case that is false, and I have a patient test case here that is true. And if I look at my feature tests, I'm reusing that same idea. And I guess the test cases themselves, we wrote in FHIR shorthand here, and they're just patient bundles that have patients with various different conditions. And when I run my my test thing, which I need to, oh man, sorry. I can actually, this is hitting a live server behind the scenes, and in this case, all my tests pass. I can show that this isn't completely magic. I can maybe comment out that then, and we should see an error. We didn't see an error.
One less step passed.
Oh.
Yeah.
Yeah, so it didn't actually run it, maybe because I, what? I'll do that because I know, oh, you know what? I don't think I pressed the save button. Maybe that was it. Okay, no, it could have been it. That actually probably was it. Anyway, I know that I'm at time now. I don't know if we have time for questions. My moderator's looking at Instagram.
We're good. We have time.
Okay. So yeah, I'll make all this available. Sorry about how it went through pretty quickly, but the cool thing I found doing this was being able to leverage mCODE, because I've been doing work in this area for a while, and it was really nice to be able to use their work directly in this and kind of really show how this stuff can be reusable. So.
Please clap.
Thank you. Deep down, you're thinking he doesn't deserve that.
Yeah, we do have time for a few questions.
Any questions?
That viewer,
Yeah.
what is that?
Oh, yeah.
A little bit more?
Taylor's.
That's awesome.
Taylor, I think, is here somewhere. Oh, yeah. We're going to be doing this again this afternoon. There's a interactive CDS, like birds of a feather demo thing, I think at 3:45. But yeah, this basically is something that it's just really hard to kind of keep in your mind how all this tree stuff works. And so this is a very early version of this tool. We hope to continue to work on it, and just, it'll be open source, and we want more people to be able to write content in this space.
That's very, very cool. Yeah.
Hey, Brian, back here, Alec.
Hey.
So question for you, for this whole plan of creating a CPG and then executing it, what tools can people use that are open source, and are there certain steps, I'm thinking maybe the actual engine itself, that there aren't open source tools to use?
So the authoring side, as you know, we do fairly VS Code style, so it's very developer-y. This preview tool is available now. It's open source. Behind the scenes, we're using a lot of the IG publisher and CQF tooling. That's also open source. There's a couple open source engines now. We have a one that's based on the MITRE CQL engine, like an open source one, and the Happy team has one, and I think there's a couple others out there now too. So you know, I think while there isn't like a complete end-to-end right now, the pieces are there, and we're seeing some traction in from some of the bigger content vendors out there that want to make experiment in this space as well. So hopefully more to come on that.
Okay, thank you very much.